Good morning, Dr. Peter. Happy to have you here on our podcast. You are an expert at the Chiropractic Center Propel. I know you offer more than that service, so I'm going to pass it over to you to give us a quick intro, what you do, your background, and then the services you offer at your clinic. Thanks.
Okay. That's a big answer there. Thank you. I'm happy to be on. I appreciate you having me on and everything that you do. Um, yeah, what can I tell you? I mean, so I'm a sports injury specialist chiropractor. We have opened up this clinic, Propel Active Health and Lifestyle, about 6 years ago, or just over 6 years ago now, with a mission to offer comprehensive musculoskeletal healthcare and fitness. And yeah, it's been a while now, and we love doing what we're doing. We have a great team. We offer all kinds of services, chiropractic being one of them, but also physiotherapy, massage therapy, kinesiology, and fitness services right on site. We like encouraging people to stay active and figuring out solutions that are evidence-based to keep people active in whatever it is that they want to do in life, whether it's something as simple as gardening on the weekend or running a race. So we have a blend of people, both active and people that also want to be more active, as well as some people that are, just want to be able to go to work and be pain-free. So that's kind of what we do, and that's what I do. Yeah.
Thank
I'm
you.
not
Thank you
sure if
for
I
that.
answered all those points that you asked.
Yeah, I think that you cover the majority and what is key for the discussion, and it's really relevant, important. The majority of adults, I think, around our age, must have gone through any type of injuries their lifetime. I am one of them, and I know when you have pain doing like regular things, common things that you never notice, it's so hard to move around and to just sometimes go through the day could be a challenge.
Mhm.
So it's great to know there's solutions in place, the way you approach it, and that specific objective, like to be free of pain, move around and do. Maybe it could be regular tasks, day-to-day tasks, or for others that are endurance athletes that help as well to recover and perform they should. So thanks for the insights and the intro, and we're happy to hear that you've been working for more than 6 years and offering treatments and helping others. I also know that throughout your practice or on your website, you have blogs that also are really helpful for anyone. We're sharing below details of your website and whatnot. So anyone interested to learn more, to follow you, to book any appointments, they have the opportunity to review. And there's lots of information on the blog site, so that's great as well. So kudos to you on having information that also helps them navigate through whatever they're going. Sometimes you hear, and that's one of the key things from this podcast, I can hear something interesting and then I go and learn more or focus on what I'm looking to get support with. So thanks for that. And probably just to maybe paint or connect the lines, I know there's multiple services you offer, but for the chiropractic one, is there any specific things that someone that might never have done the treatment should be aware or learn from, like benefits, how the approach of the chiropractic session is? Feel free to give us any details.
Yeah, it's a great question. I think the general consensus these days still is that when you go see a chiropractor, you're seeing them for spinal pain. Um, there's there's ideas about what kind of treatment they're going to receive when they go see a chiropractor. Most of the time, people think, okay, it's some sort of an adjustment to the spine. And I've kind of made it a point in my career to dispel that kind of notion. I do feel it's a myth, especially when you look at the more current education that you see within our profession. Um, Even though most of the public still perceives us as the typical, go get your back cracked type healthcare providers, it is important for me to tell people that that is not all we do. In fact, that is just a small part of what we do. Now, of course, there are clinics that still do that kind of a treatment, and they will get some people better, and then they won't get everybody better because they focus on one tool within their tool belt. I think it's important that modern chiropractors have more than one tool in their tool belt. In fact, they should have all the tools that are supported by science in their tool belt if they want to help as many people as possible with musculoskeletal conditions, which may involve the spine, but it may also involve other joints. It may involve muscles, tendons, ligaments, nerves. So I think, the way I want people to reframe chiropractic in their minds and the way that we practice here and the types of services that we offer is we start with, okay, what can I do for this patient that is supported by evidence that will get them better? And really that's the general theme. So look, if that involves an adjustment to the spine, we may do that. If it involves some sort of like advanced soft tissue therapy, we'll also provide that. In fact, we do quite a lot of that because most musculoskeletal injuries actually involve the soft tissues, which are tendons, muscles, and things like that. Of course, when it comes to managing conditions, there should be an active component to care as well. And what I mean by that is that some sort of exercise, if there's a weakness, if there's some sort of like an inhibition or a lack of endurance or some sort of a muscular deficit, that should be addressed as well, in addition to the range of motion deficits that we may see in people with certain pains and conditions. So an active care component could be stretching, could be active mobilization exercises, it could be strengthening, it could be improving strength or conditioning of the patient, depending on what they come in with. So we offer that as well. And of course, I do believe strongly that every patient should have that component checked off in their care. Chiropractors, in addition to doing more than, just adjustments and soft tissue therapy, they may also use other modalities in their care, as long as they're skilled enough to do that and have the right training. And some of those may involve things like acupuncture that has been shown to improve certain painful conditions. So we utilize acupuncture in our practice as well quite frequently. And that may be to improve symptoms, decrease some sort of pain, speed up healing, things like that. When it comes to healing, we also use other modalities, such as class 4 laser here specifically. And then other chiropractors may even use other modalities like shockwave therapy, which has been shown to be effective for certain repetitive strain injuries like tendonitis and such.
Great. Glad to hear you have a holistic approach for recovery. And I know certain tools, I don't know if it's tools, but the way you provide your services and the care helps a lot. I've gone through acupuncture in the past and I did find it worked for me. So it's good that you have lots of options and opportunities for the treatment to be complete and to address it, I think, accordingly to each and everyone's needs, right? Okay, thanks for that, Peter. And also, I know when someone comes, let's say there's a specific injury, and depending on how you address the situation or the diagnostic you find, then you'll suggest either to go with other things in conjunction. Let's say maybe if I do a session plus some exercises at home that I need to work on to, let's say, make my core strengthen and probably the back pain will go, just to give an example, then it can be as well paired with, let's say, some massage therapy or other types of things that will help that recovery. Is that the approach?
Yeah, absolutely. Utilizing a comprehensive team is important. Because it helps divvy up the load, right? When you come in and see us for 30 minutes, there's only so much we can do. So if we can tag in other healthcare providers, that's usually in the best interest of the patient. And of course, these days with, insurance companies aren't exactly throwing more and more coverage at people. So healthcare dollars go a lot farther when you can start amalgamating other services into the core treatment plan. So, we do that a lot. I do think a lot of multidisciplinary clinics are good at that as well, tagging in other healthcare providers. And that also depends on the patient's previous experiences as well. So if a patient comes in and I'm doing, I have a plan of management that involves acupuncture, soft tissue therapy, joint mobilization, and exercises. That's a lot of things to do all at the same time. But if that patient has said, you know what, like massage therapy has helped me a lot in the past, whenever I've experienced muscle tension or muscle pain, and if I believe that there's a huge muscular component, oftentimes I can offload that to the massage therapist. They can see the massage therapist and use their massage therapy healthcare dollars for that. And then we can focus on some of the other aspects that are also very important. We can, instead of watering down the treatment and trying to do everything all at once, we divvy it up and split it up a little bit. So of course that has a lot to do with patients' previous experiences, their coverage and how that works. And then of course, there are multiple healthcare providers within this practice, and we all have our little niches. And sometimes, if I have to send somebody for dry needling, I'll send that over to our physiotherapist, who's excellent at that. And it's a bit of her specialty. And that way, once again, I can focus on some of the other therapies that we can just kind of put a little bit more effort and emphasis on together. And I could tell the patient, like, look, you got to go see Crystal or Jess, because she's excellent at that. She's going to take care of that portion of her treatment, and we can focus on these aspects of the treatment. So using a comprehensive team, having a team you can trust is so important. Within a setting like this, it's all in the patient's best interest.
Thank you. And yeah, you touched upon one thing that I was going to mention, like someone that you trust, that you can send them to. Okay, you have to do physio, and then you have someone is going to do a great job. So it's a plus, like a check you have there, that you have an integral team that can help you and support the patients. And as well, talking about insurance, we know like there's a specific type of coverage amounts, and if we can go through the different buckets and get relief, get a great treatment and feel good, or having like pain-free life, that's amazing. And the other thing that you mentioned around insurance, I know you bill directly to the insurance companies, which is great, because in other experiences, like getting out of there and you have to rush and do things, and you have to still take care of so many other things for plus that admin thing. So it's something that you're taking care of, that I am sure it's greatly appreciated for patients like myself.
Everybody's so busy these days. It's one less task on the docket, and it's quite easy for us. We've made it a point since we started this practice that we're going to offer that as a point of convenience for our patients, and we've been doing it ever since. We can direct bill to most insurance companies, and that's really takes off a lot of the stress to our patients.
Totally. Yeah. Thanks for that. And the other thing that I was gonna review or discuss that might go in alignment, some of the things that are great from a patient experience, is if you have enabled forms, things that will do things digitally, automated. That's something that also helps a lot from an experience perspective. So I'll let you dive into that one. And also any type of technology that you want to mention that is helpful for them to probably get information, to maybe assist them off hours, any of that you might be able to elaborate on.
Yeah, I mean, I think as we go forward, technology is going to become a bigger part of healthcare. We can't deny that. It's already happening, and I think the best solution is to embrace it, as long as it's in the patient's best interest. We've utilized technology when it comes to scheduling appointments, creating ease of booking appointments, reminders, communications digitally versus paper forms. That's always been a staple of ours since the get-go. There's amazing technology in place already that allows healthcare providers to do that quite easily. It makes running a practice easier, and it certainly provides a value add to the patients. knowing that they can schedule an appointment and get an email reminder 2 days prior and a text reminder the day before is actually quite great, because first of all, it's nice to have that reminder when everybody's so busy, but things also come up. So if you forget it about an appointment and then you realize an hour before it that you cannot make it and you haven't even thought about it, it hasn't even been on your mind, then that's a problem both for you as well as for the practice. When getting reminders 24 hours before with a text message is actually quite good, because then you can evaluate your schedule for the next day and see, okay, oh, wait a second, I gotta move that appointment lower down in the day so I can still get my care and do it in a sufficient fashion so that healthcare provider isn't left waiting for you because you've forgotten about the appointment, right? So I think technology is going to become more and more involved in healthcare practice. Of course, we're now seeing how AI is affecting healthcare. Specifically within practices, healthcare providers are utilizing AI Scribe for note taking, helping them keep more detailed notes and be more comprehensive with their note taking. I think that's going to be more and more utilized in the future as we go forward. And in fact, there probably will be a time where healthcare providers are not using the keyboard as much as they have been in the past, which is probably good for their neck and shoulders, so they're not hunching over their laptops. Of course, it also provides just a much more comprehensive note. It can do that in a fraction of a second versus taking substantial amounts of time out of the healthcare provider's time that they could be using to maybe plan a better care plan of management for their patients, or do any continuing education or research that they need to about a specific patient. So anytime that we have extra to do stuff like that to enhance the value for our patients is always a good idea. Some of the other technology that we've used is we've recently utilized an AI chatbot on our website just to help patients get some quick answers about our services. And I think that's really been helpful. Shout out to 15 Element for helping us set that up. Great company, as you know. Thank you. And that's been really helpful, because a patient now can go on our website, and instead of navigating through website, they can actually go directly to the bot, which is informed by our website. It has access to a knowledge database about our services. And they can even answer questions like, okay, where are you? What are your hours? What are this healthcare provider's hours? Tell me more about active release therapy or technique. Tell me more about how laser therapy can help me. So really valuable stuff that I think more and more healthcare practices are going to utilize in the future.
Thank you. Thanks for your insights. And as you mentioned, I find technology these days, it's out there, and it's for anyone in your situation, or any like healthcare practitioner. The worth and the value you provide is attending the patient's needs, and then figuring out like your time is best used where you can only do the work you do and where you provide the most value, right? Admin work, as you mentioned, like taking notes, billing, like certain things that obviously can be done in a expedite manner, and providing information, let's say with the chatbot, as you mentioned, you will not be around 24/7, which is obviously not doable, but it's always nice from a patient perspective too, to have some type of support information that can help them at least learn more or see what are their options or the things they can do. And having that connection or communication, it's not directly with a human, I know, but providing the value, and then they will have that connection, that interaction with someone like yourself or any one of the practitioners on your clinic. So I think that's great. As you mentioned, like the value you get on what you do, you have more time to take care of your patients. So that's great.
Yeah, it's very, very important to hop on the bandwagon, right? Because at the end of the day, it just helps the healthcare provider, and it ends up helping the patient indirectly as well.
Yes, totally. And I know we're almost close to our end, but a couple of things. One of the highlights I found on your services on your website is bike fitting. So maybe someone listening needs some support or so, and I'll let you know, speak on it. I'm not as well versed as you, and I'm not the expert, but that was something that caught my attention at some point, like reading, like, okay, oh, there's bike fit. So over to you just to know if there's any specific things to consider or to learn from as well.
Yeah, no, thank you. Good question. Yeah, but our bike fit service is a bit of a niche service for sure, but I think it's a very important one. These days, more and more people are getting into cycling, and I'm a huge fan of cycling. I think everybody should own a bike, and everybody should consider becoming an avid cyclist, not just go out to the lake on the weekend. It's a great form of exercise that you can maintain well into your elder years, whether it's indoor or outdoor. I think everybody needs to own a bike. Now, with that being said, being comfortable on the bike is also very important, because the more comfortable you are, the more likely you're going to spend more time on the bike. And you're definitely going to spend more time if you're more comfortable. So a bike fit service is essentially like an ergonomic assessment for your bike. So if you can imagine a typical standard ergonomic assessment, we typically do that for office workers, adjusting their workstation, positioning their monitor, keyboard, mouse, seat, everything. Well, essentially that is the case for a bike fit service as well. Somebody comes in with their bike. The first thing that we do is take a history of how they feel on the bike. Then we do some sort of a physical exam that gives us an idea of how their body moves, and if there's any physical impairments to their movement, that will then be applied to the actual bike fit itself. Then we do a functional exam, basically seeing how people move. And then very soon after that, we place them on the bike and we do a dynamic bike assessment, which is essentially me looking at them cycling, doing several digital measurements on the bike. That allows me to know whether their seat positioning, their handlebar positioning, their cleat positioning, and overall any kind of touch point on the bike is positioned properly for them based on what I found during the physical exam and the functional exam, as well as how they're presenting on the bike itself. So it's a niche service because it's specific to cyclists, but it allows cyclists, especially ones that are very serious about it, to be much more comfortable on the bike, as well as improving their performance, which is always an important aspect of the cyclist's frame of mind, right? They pay $10,000 for a bike. They want to be able to keep up with their friends. So they need to be able to transfer as much energy into that pedal as possible so they don't have to work as hard. And they want to be able to go on long rides, hour, 2 hour, 6 hour rides, right? So it's every little tweak that we make allows them to stay on that bike for longer and stay way more comfortable. So it affects sustainability on the bike. I do think this is a service that healthcare providers should be providing. And traditionally, this service has been provided by bike mechanics, which is great. Bike mechanic, nothing wrong with bike mechanics providing the service. Some of them are they're experts in their field. But the education that healthcare providers get when it comes to injury mechanics, cycling mechanics, is very valuable when it comes to this sort of a service. So being able to take the patient's history, whether they have back pain or hip pain or anything, and then being able to apply it to how they position on the bike is actually quite important. I think nobody can do that better than a healthcare provider. I've taken on that role for the last few years. I've been doing this for about 5 years now. I'm a sports specialist chiropractor, so my shtick is working with active people, athletes, but active people in general, cyclists. I've seen cyclists my whole career, and I've always done bike fits from a distance. Somebody comes in and they complain of something very specific while they're on the bike, and while I treat their injury, I made recommendations. Perhaps you got to move this, or you got to move your bars up, or your seat's too far forward. But it was an educated guess at best, and sometimes it helped them, and other times it didn't. So finally, when we got this place, 6.5 years ago, we had the space to do the service, and I got fully trained in and being able to provide the service, and I've been doing it ever since. It's a great service. It's been very successful. People love it. Most cyclists don't really know how comfortable they can be unless they've had a thorough bike fit. So it's really satisfying to me when somebody comes in, they can leave and instantly feel a difference when it comes to their comfort and their power. Or perhaps if they are coming in with a cycling related injury like knee pain or low back pain, them leaving and going on that first ride and experiencing a drastic difference in their symptoms is very satisfying for me as a healthcare provider.
Thank you. That's really interesting and makes total sense, because when you go and do, I don't know, lift weights or do different exercises, you get pain, or you can get a discomfort at some point, and the proper form, doing it with the right weight and so on and so forth, it just translates the same when you're doing like cycling, and if you're trying to go from a longer perspective and like doing it formally, as you mentioned, it makes total sense to also take a look into what you're doing, the way you are performing, and if there's any specific pain to address it. So thank you. Thanks for letting us know how it works and the beauty it can make for someone riding their bikes. So thanks again.
Getting on a bike, you can go for an hour ride and put in thousands of repetitions, right? So, or a 2-hour ride, right? Like, you know, it's such a repetitive motion, and the strain accumulates over time. So small adjustments make all the difference when it comes to, you know, getting on the bike, because you can you make that small adjustment and take some of the strain off of an area, and now those thousands of repetitions that you do in, you know, in a matter of a half hour, you know, it just takes some of the strain off and makes people feel better. So makes sense.
Yes, thank you. Thanks. And before we wrap it up,
Mhm.
is there any maybe, I don't know if it's like a thought or advice you can give anyone in the audience for like their daily lives, maybe consciousness about how they're doing things? It can be, as you say, you do regular things, maybe picking up an object, and sometimes you get injured from like things that might not be as hard as you say, like I did a deadlift right at the gym. So any final comments, advice, daily things that might be worth for someone to apply?
Oh, well, I mean, I don't think this advice is gonna be anything unique, but as a healthcare provider, I feel like I need to repeat it. More exercise equals better health, and in so many ways, not just when it comes to pain, but physiological health. Everybody knows that, but I feel like, you know, some people just need to hear more of it. Our bodies crave exercise, and the more we move, the more active we are, the more we crave it. But sometimes people don't really realize how much better they can feel because they're sedentary. And in order to get your body to crave that exercise and to really start feeling better more regularly, to really feel the benefits of it, there needs to be a certain amount of consistency, no matter what the exercise is, whether it's walking, whether it's getting on a bike, whether it's picking up weights. The key is consistency. And once you reach a certain point of being consistent with moving, no matter what kind of movement it is, you will start realizing how much your body actually craves it and how much better you feel when you move, and not so much when you stop. So I think that's a really important take-home point, period. Our job is to keep people moving. We see less people when people are moving, right? Obviously, activities themselves can injure people as well, but you want those kinds of injuries. You don't want the injuries that you get from being sedentary. You want the injuries that you get from being active. Those are always way easier to manage, Your thought process is perfectly aligned. Okay, how do I actually get back to moving? Yes, I did get hurt. How do I get back to moving? And that mental state is already sets you up on a straight course towards success. Versus when you start, rounding that 40, 45-year mark, and you've realized that, oh my goodness, I haven't been active since I was a teenager. Now you're getting into injuries that are caused by being sedentary. And guess what? We treat you, we make you feel better. That result may be temporary unless you actually start conditioning your body for movement. So you're either conditioning your body in a positive way or in a negative way. So it's important to do that positively, which means that you have to stay as active as you can in life. And yeah, people will still get injured. I mean, being mindful about how you move is important. Plenty of people injure themselves by picking up a pair of socks off the ground first thing in the morning. But, when you're in the gym and you're picking something up, you do something with very specific technique, and hopefully you don't get injured, right? Less likely. So keeping some basic exercise principles in mind when you do certain things, like pick up a bag of dirt so you can go gardening, doing that with proper form is actually quite important. You got to think of it as like going to the gym. All right. And if you think about it that way, your chances of getting hurt are much less likely. So life is an athletic event. If we treat it that way, then we tend to get injured less. But definitely the goal should be to continue to move and not be afraid to move. And if you are, then you need to get help, and you need somebody to help guide you back to activity.
Love it. I totally like your words. It resonates, and obviously, from a physical standpoint, makes total sense. But also in a mental way, I find doing exercise, moving around, has such an impact in your daily life and performance. So I'm a big proponent. I love what you say. I need to move around. I need to work out. So for me, it's like, okay, music to my ears.
Yeah.
I feel stressed the days that I do not work out. I have lots of energy, and at night I'm just like turning around, and like I do need to burn that energy. And
Yep.
also for the body, if you, as you mentioned, if you are sedentary, the way that you're gonna recover takes longer.
Mhm.
And if you have any types of injuries, being an active person, your body, your muscles, they're just like easier to recover. And you know that better than I do, but those are my 2 cents as well from what you mentioned.
Yeah, absolutely. So yeah, you're hooked. Like that is the level that most people or everybody should try to strive for. It's like, and it could be different things. I know that you do high rocks, for example, and you're very active in that, and good for you. That's such a great form of exercise, well-rounded. But it could be something simple, and it doesn't have to be complicated. I think just some people just need a little extra push and a little bit of guidance. And it's on us to help that. Getting people past pain is one thing, but also asking the questions. Okay, what is it that you want to do? Like, is it just to get past pain? It might be that, and that's where the conversation ends, and that's fine. But is there anything that you aspire, and is there any activity that you aspire to perform? Whether it is a 5K road race or being able to go and do a Zumba class or a bar class or any other kind of form of exercise. And then that guides our plan of management towards that now. And it changes, it's less reactive. It's more, okay, now that we've got you out of pain, how do we work towards that? What are the steps? And what do we have to do to keep you there? And maybe even push you further.
Excellent.
Yeah.
Thanks again. Thanks for your words and for providing all this information to the audience. And well, thank you and have a great day, Peter.
Yeah, you too. Thank you very much. Appreciate it.